Hello, everybody. This is Janine Taylor with District Health Department number 10. I am recording this, so Dr. Morse, if you're ready, you can go ahead and get started.
Alrighty. There we go. All right. Well, I probably have too much stuff to share, but I'll get through it. I just had some interesting data and studies from the CDC, but I won't spend too much time on it so that we can have time for question and answers. Okay, so the new order that will become effective February 1st early morning, was released already. Really, the only major changes were made to affect entertainment facilities and food service establishments. So if you're interested, those changes are listed in number 3 of the order. Winter contact sports remain on pause at this time. So there are no changes to that at this time. There's a link here. Again, we'll share these slides or post them on our website as usual. But this was shared with me. I can't remember who shared this with me, but this document was just recently created. It's just a page and a half overview of Public Act 238 and 339, just talking about essential workers in quarantine. Per the Michigan law, this Public Act, it does not include teachers or education staff in this, but it does just explain things and a little bit of Public Act 238 if you would like to have that, because I know that's often been a point of questions. So I just wanted to refer you to that reference. This is one study that was recently published by the CDC talking about cases and transmission in rural schools in Wisconsin. So I looked at 17 different schools in rural Wisconsin. Can you please mute your phones or computers for me? Thanks. So it's about 5,000 students and about 650 staff that were looked at from the end of August until the end of November. During that time, that community was seeing quite widespread transmission. Students were asked to wear masks at all times indoors, and when they could not establish 6 feet of distancing outdoors, and their students were compliant with mask use at least 92% of the time. Staff members were instructed to wear masks as well and have limited shared indoor spaces and maintain social distancing. The classroom cohorts were between 11 to 20 students, and they avoided mixing with other students as much as possible. They tried to seat kids with their own cohorts whenever possible, and all classes and lunches were held indoors. So it sounds like situations very similar to what we do in Michigan. If a student was excluded because of symptoms, their siblings were excluded. What they found is over this time period, they had 113 students and 58 staff members that did have COVID. Among all of these cases, only 7 were attributed to in-person transmission. 5 were in elementary schools, 2 were in secondary schools. 3 of the 7 were in one class in one elementary school, so one specific outbreak. And then the other 4 cases were in 4 separate schools. So this shows the cases and the percent positivity. This top hashed line is the percent positivity for the county over time. So they had that increase in the fall as pretty much the entire country did. The percent positivity is shown on the right side. You can see they got up to 40% positivity at one point, which is just, wow, that's really high. The black line here is the total cases per 100,000 total community population. The blue dashed line is the cases in the school per the school population. So their rate in the school was, was lower than the rate in the community. And then the bottom dotted line were the cases attributed to in-school spread. So just kind of illustrating that. This is a little graphic that they came up with for this, but just showing that, with proper precautions in a large number of schools in an area with high community transmission, there really was low amounts of spread within the school. So again, just more data available to us in a real world setting. This is another study that recently came out, a high school wrestling tournament in Florida. There were 10 schools involved over a 2-day period. Some schools did come and go during that time. There were 130 student athletes, coaches, and referees involved. The first person to be detected that had been at the event was the day after. So basically they were there while they were contagious. It didn't really say if they were symptomatic at the time they were there. So among the people that were there, only 40% of the people that went to this event ended up being tested. But of that 40%, so 38 people out of this 130 people tested positive. And again, we only know about 40% of them. So that's 30% positive out of the attendees. It was 31 wrestlers, 3 coaches, 1 referee, 1 non-wrestling high school coach, and 2 students that were not wrestlers that tested positive. There were at least 446 close contacts. Of the cases that were identified, 62 are household contacts, 384 were either in school athletics, or classroom contacts, or others. Only 21% of the close contacts were tested, and of those that were tested, 43% of them were positive. So I kind of give a breakdown here. 60% of the household contacts that were tested were positive, 33% of the classmates and teachers were positive, and 54% of team members that didn't go to the tournament were positive. There actually was 1 death associated with this outbreak. It was estimated that 1,700 in-person school days were lost. So I know that seems like an odd number, but they kind of calculate how much school time was lost due to all the isolation and quarantine for basically about 500 people. They figured it would have been higher, but about 1 week after this tournament, the school districts went on winter break. So again, just another study, just increased data here for you. Then they did present some information on the National Football League. They actually did contact tracing using Kinexon, which is a wearable device that calculates exactly how close you are to people for how long. They found that transmissions were observed in people who were close to each other for less than 15 minutes in this athletic setting, and talks about their testing rate. They had about 2.9% positivity during the August 9th to November 21st time period. They did have an outbreak of 21 people within 1 club. And again, that was one spot where they had many of them that were not together for 15 minutes. They would not have normally been considered close contacts. So just showing it's hard to really define what a close contact is all the time. Somehow I have a duplicated slide, so I apologize for that. This is really small, but it's just something for you to look at. This shows on the left side is just what their normal protocol was to prevent COVID. And then if they had somebody popped up positive, then on the right, this was the intensified preventative measures that they would use if someone came up positive. So just looking through this, it was an immense amount of preventative things that they went through. And again, then if someone did become positive or was positive, just really, really intense prevention that they utilized. So just wanted to share that. This is an article, I know, talking with at least one superintendent, he has read it, and I just wanted to share it as it is a very simple, brief, good overview of some of the more recent data we have. And it does discuss athletics a bit. but it, you know, it was just published a couple days ago, but just a really good review of some of the more recent information, and helps, you know, if you're trying to make a good scientific discussion or argument with people about activities and school being open and things like that. This gives you some really good information. A lot of it is based in the United States from what we know from this last fall. So again, if you just Googled JAMA, J-M-A, school data January, it should pop right up. But again, we'll share this link with you. Just a reminder about international travel requirements, effective as of 2 days ago. Anyone coming into the U.S., even if you're a citizen, must have a negative test result that's dated within the 3 days prior to their flight date. So if you know of staff that is planning out of country travel for spring break or things like that, just make sure that they're aware of that. And that is basically federal rule right now. Then it is recommended that they get tested within 3 to 5 days upon their return and that they stay home for at least 7 days, even if they're negative. But if they don't get tested, it is recommended that they stay home at least 10 days. May even want to consider 14 days given the different variants that are going around right now. I did paste in here the current recommendations for domestic travel. They are really stating, you know, you can see a lot of bold in here, but this is a direct copy paste from the CDC that travel will increase your risk of spreading and getting COVID. Staying home is the best way to prevent it. That you can still spread it even if you feel well. If you've had a known exposure, you should delay travel. Don't travel if you're sick. It might increase your risk of traveling to others. And recommendations for when you do travel. Shoot, I guess I didn't put in here what to do when you. The recommendations for return are. Thought I put in the recommendations for when you return here, but it's essentially, it still is essentially the same, just stay distance from others. There really is not a requirement to quarantine when you come home from domestic travel, but we will keep you posted if that changes at all because we know spring break is coming up. But I wanted to share this with you because, you know, if you want to start messaging now at all that traveling really does increase your risks of getting and spreading COVID, and the best way to prevent that is to stay home. I know you can't force people to not travel over spring break, but with the new variants that we have, there definitely is concern. So we continue to discuss and follow and consider, you know, what's best for travel, and if there should be different recommendations after return from travel. So we will keep you posted as things develop. There is a link at the CDC where you can put in your domestic destination. So this is not for international travel, it's for domestic, and it will let you know if the place you're going has restrictions. You know, if you're going someplace that doesn't allow you to go out of the home, you know, it's not going to be a real fun trip. So this may help people make some decisions. I noticed too, going through the updates on the CDC website, this is, I think it was a 52-page document, so it is a bit long, but this is a new tool from the CDC. It's basically like a checklist to kind of go through and, you know, ensure that you have done what can be done to prepare your school for COVID prevention. It is a nice tool. Again, it is quite long, but if you have someone in your school who is in charge of COVID prevention, you know, it's something they might want to look at just to see that nothing's been overlooked or that there isn't something that might be improved upon, or some regulation or prevention that might be tightened up. So I just wanted to share that because that is something new. This I shared last week, but I wanted to share again. This is just some information that you can use as you are encouraging your staff to get vaccinated. Even if you've already had vaccination opportunities for your staff, you can still use this to try to encourage those who passed on the first opportunity. They still can get vaccinated at another time if they haven't yet decided. Last week we shared some guidance on what to do after vaccination if you have employees that are having fever or have body aches, different symptoms, how to deal with them. We did send that out and/or post that on our website. So it is posted on a couple of our websites now. So I did put here how to find that. So if you can't find it in your inbox somewhere, there are links here where to find that on our website. So again, with our vaccinations, we are still working as hard as possible to get those out to you. You can go to our website to find information on how to sign up. If someone hasn't talked with you by this point, someone should have contacted or instructed you on something in terms of registering or signing up with all of the respective health departments. In terms of data, so the positivity average for the state is down to 6.2%. For the entire state, all of our regions are now below 10%, and 70 of our counties are below 10% now. So definitely continuing to move in the right direction. The case rate has gone down to 203 cases per million. That's down 72% since we peaked in November. So again, the state as a whole is definitely improving. The number of active outbreaks in the state is down a bit. We have had a slight increase in the number of school outbreaks from last week, from 40 to 54 statewide. But again, school is back in session and going full force, and the state is actively encouraging more and more schools to go back to in-person, whereas there were many that had still not yet gone back in person. So percent positivity statewide is at the top. Daily cases per million is in the middle, and you can see really continuing to drop. And the daily hospitalization rate is on the bottom here. That tends to be delayed behind behind cases, because people tend to get hospitalized several days into their illness and are often hospitalized for many days. So that does tend to lag behind the daily case rate. So these are our outbreaks. You can see the K through 12 schools here on the 5th line. There are 26 active outbreaks. Again, a outbreak will stay listed until there's been no associated new cases for 28 days. And if someone, doesn't notify the state that it's over, it might not get taken off the list. But again, 26 new outbreaks since the previous week. Here are the number of cases. So I'll just skip down to the bottom. I think that's a little bit more useful. So out of 21 outbreaks in high schools, there's 40 cases. So basically, in my mind, that says there's the original case that was acquired in the community, and then one additional case for most of these outbreaks, because there's a minimum of 2 cases per outbreak. I think the range per outbreak is 5 to 19. Outbreaks. So this must be total for all of these. So so I apologize if I'm confusing the situation. And then our regions, it used to be our region 7 had huge numbers of outbreaks. But again, things are doing a lot better. Hopefully the trend will continue now. Our healthcare capacity, hospitalizations are down 62% since our peak. ICU occupancy is down 14% from last week. Our deaths, again, deaths are also something that tend to lag just because it doesn't usually happen when the cases are happening. It happens later on, but they continue to go down, which is definitely a good thing. This is the hospitalization rate, and our regions are 1, 3, 6, and 7. So again, all continue to go down. The only one that had a little bit of a bump up was region 1, and as you can see, it was just the tiniest little bump. And I'd almost question, how significant that is. So our test turnaround time, if you remember much from previous weeks, this really is pretty consistent from previous weeks. So about a day and a half. Can we please make sure our phones and computers are on mute? Thanks. All right. And then in terms of our case investigation, it just keeps getting better and better. Of course, it helps. We have a lot less cases than we did last week, but you can see that 88% of the cases statewide have been fully completed, which if you've ever seen one of our case investigation forms, it's a lot of stuff. So that's really good that 88% are complete. 42% of people know where they got COVID from, and 26% of people were already in quarantine. So those two numbers are pretty consistent, but you may recall back when things were really hopping, this was right around 20%. So our ability to investigate cases with the help of the state and other groups has greatly improved. So should be able to see the data here. Again, we'll share this like usual. For the state, again, their cases per million went from 237 to 188, and percent positivity went from 6.7 to 6. For the 6 counties of Central Michigan District Health Department, the average went from 188 to 190. Make sure I'm on the right week. Yep. The different counties have just kind of bounced around, but still on average are continuing to decrease. Percent positivities are all in single digits. Isabella County is actually down to 3% positivity, so much, much better. Looks like I missed changing the color. Isabella County is actually down in the D category. I just missed that one to change the color on. So overall, everything is status quo to better. The 10 counties of District 10, the average has gone from 209 per million to 156 per million, and percent positivity has gone from 8.6 to 7%. Again, several of these have gone to the very high category from the highest category, and we have some of these that the percent positivity are quite low. Not quite sure what's going on with Misaki. I don't know if that's a calculation error there. What was theirs last week? It was 10.2. So we might want to follow up with that. And the 3 counties of Mid, much better. Last week, 234 cases per million, now 173. Percent positivity is averaging 3.8%. Obviously still getting, spurts of cases, but still they're trending downward as well. So things are improving. So hopefully this trend will continue. That is it for my presentation. Like I said, I know that was a lot of information. and we'll share all of that, but I just wanted you to have the latest and greatest in terms of data. I can go to the questions. I think that's, I just have to find, okay. So, okay, so it looks like some people couldn't see my screen, so I'm hoping people were able to see it okay. What are your thoughts on elementary students checking out books from the school library? So yeah, we talked about that a long time ago. I think that's fine to do. It has been shown that the virus can live on surfaces such as books for about 3 days. And so ideally, what would be best is that after the book is at someone's home, so when someone returns the book, to put it in its own little quarantine for 3 days before allowing it to go back into circulation again. If a child is healthy and is just looking at it for a short period of time, I think the risks are pretty low in terms of putting that back into circulation immediately. There actually is an excellent library resource that I can share. So I'm going to make a note to myself, library. And where I found they actually had done research studies and did viral cultures to test how long the virus can live on books. So I will find that and share that link when we send out information. Scott, just because I can't remember everybody from everywhere, which district are you with?
Yeah,
what county?
With music schools in Wexford County.
Wexford, okay. So I'll track down your email then, because I know for Wexford we just post stuff online. So I'll find your email and I'll email you that information.
Thank you, Dr. Morse.
Yeah, no problem. With regards to travel, what if we have had both doses of vaccine? So with the vaccine, 2 weeks after you've had both doses, we're pretty sure you're 90 to 95% immune. The latest data right now, kind of working out of a test tube though, is showing that depending on the different variants, the vaccine may not be as effective. So if you travel and you become exposed to one of these newer viruses, we don't know exactly how well the vaccine will work. So in terms of going out of country, I mean, all those same rules are going to apply to you. You'll still have to test negative and all those different things, just because that's the rules right now. We can't really change that. But until we know how things work, until we really can prove, yes, this is going to protect you, or no, it's not, we still have to use all of our precautions until we know. So, can you clarify the change in the new executive order not allowing slit masks for music class? So the new executive order that will go into effect on February 1st, I went through it word for word and I saw nothing about that. So if there's something I missed, you can email it to me and I'll look at it, but I went through it. Whenever a new one comes out, I put it up against the old one and go through it line by line to look for any differences. And I saw nothing about music classes or anything like that. So, so again, just shoot me an email with whatever it is that you have question about, and I can look at that and follow up on that. I know that the state has previously put out guidance specifically for music classes, and they specifically recommended slit masks. So that was probably about 3 or 4 months ago. Possible scenario, a staff member lives with a family member who tests COVID positive. How concerned should we be if we were further than 6 feet from them? So if you have someone who was a close contact to somebody and you are a contact to that contact, you should not be concerned unless they then go on to become ill or test positive. A contact of a contact really doesn't have anything to worry about. Usually, if a close contact is going to get sick or test positive, it's usually once they're in quarantine, and most of the time they're in quarantine during the time that they're contagious. So usually we get them into quarantine before they become contagious, which is the goal. So again, you don't have anything to worry about. And if they get sick or test positive, if for any reason they happen to be at work those 2 days before their symptoms started or before they tested positive, then you go from there. But at this point, you don't have any reason to worry. What is the protocol for staff who run a temperature that can be attributed to their second dose? So that's that reference that I was referring to. Let me go back to it here. I think I called it the post-vaccination guidance for employers. If they have the systemic symptoms, let me find it. There we go. So what I'll do, let me just pull this up and then I'll just pull up the screen here. So you should be able to see this screen. So if you go to one of those links, you're going to see this document. It says post-vaccine consideration for employees. This is modified from a document that the CDC will refer you to in the essential worker toolkit, but the one that they refer you to is for healthcare providers, and it's really written for healthcare providers, so it's kind of high level, lots of sciencey terms. So I'm just going to go down here where it's a nice table. So if somebody has fever or fatigue or headache or joint pain or muscle aches, if they have not had a fever and they have any of those other things, and they have not had a cough or shortness of breath or sore throat or anything like that, they can come to work. If they have had a fever though, then they should be excluded from work until they've been evaluated. And if they don't have any signs of infection, so if they get tested for COVID or even the flu or whatever else, if they've not been found to have any kind of infection, then they can come back right back to work. But if they just have, if they're just achy and tired and have a headache, and they don't have cough, shortness of breath, any of that other stuff, they can come to work. So again, this should talk through everything you need to know and help you with those questions. So, all right. Is there a resource available that tracks trends and reported side effects of the first and then the second dose? Well, yes, actually. Let me see if I can find that real quick. The American Academy or the Advisory Committee of Immunization Practices just met yesterday. So here, let me share my screen again. So here are their slides from yesterday, and it was in the, I think this one. If I'm making you guys dizzy, just yell at me. All right, so this after 12 million Pfizer doses, first doses, and 9.5 million Moderna doses. And I'm not sure how many second doses of Pfizer. But after, and we don't know, they didn't have the second dose data from Moderna, but my assumption is going to be, it's going to be about the same as the Pfizer. But the percent that had pain, first dose, second dose, tiredness, first dose, second dose, headache, muscle pain, chills, fever, swelling, joint pain, and nausea. So that gives you an idea that, so you're twice as likely to have tiredness. You're not quite twice as likely to have a headache, muscle pain, chills, fever. So you can kind of see there. So hopefully that answers that question for you. I can share this link with you if you'd like. In fact, I'll just share it right in the
Dr. Morse?
chat. Yeah.
I asked the question. My name is Melissa Isaac. I'm from Isabella County.
Yeah.
So I appreciate this. This is a great resource. Are there any, because we're talking mostly about physical reactions, is there anything out there like that shows a trend in maybe increased anxiety or depression or any of those mental health things that could possibly be connected to the vaccine?
I have not heard of any issues like that, first or second dose. This also has in here information about allergic reactions, anaphylaxis with first and second. So like here, there's been 3 anaphylactic reactions with a second dose. So it's usually it's going to happen with your first dose. So I've not heard, and any of my nurses on the line can jump in if you want to. I've not heard of anyone having those kinds of side effects with the vaccine.
Thank you.
I've not read about it either. Yeah.
Thank you.
Yeah. I gotta find where I left off. Okay, travel protocol. Okay. Mark was just saying thank you. So to all my staff, there you go. I apologize. Questions. Guidelines, protocols for school staff that start symptoms after the vaccine. So we just went over that. It's in that document. Again, the link will be in the PowerPoint. It goes through exactly what to do and how to work through that. If you have questions, once you've had a chance to look at it, just email me. It also talks about, trying to schedule, and I know it might be hard. I know my immunization staff probably wants to smack me after I say this, but trying to schedule such that your staff may be on the cusp of a couple of days off, trying to stagger so that not all of your staff get their second dose on the same day, things like that, as much as possible in terms of the second dose side effect issue. What data will need to be seen that would encourage the health department to lift restrictions? Well, right now, in terms of restrictions for sports, we're not in charge of them. The data that I have seen, well, I don't think I'm going to get into that right now because I think I've presented the data that we have consistently seen as to where some of these outbreaks come from. And as far as travel is concerned, will restrictions that are in place now be lifted for people who have had both doses? So again, it will take time for all of our restrictions. So mask, distancing, gatherings, all of those things. Once we have to get enough people vaccinated and then know how well it's working in the real world for those things to be lifted. So hopefully it won't be that long, but but in terms of the right now, nothing is different for people who have vaccines compared to those who don't have vaccines. Have the health department in general shifted their focus to vaccine distribution rather than contact tracing or notification? Our district rests in 4 counties with a minimal case confirmed. Since Thanksgiving, literally, we've had 5 confirmed. So I'm not sure what county you're in. I know that a lot of our counties are utilizing the state case investigators and the state contact tracing resources because all of our staff is busy with vaccination efforts, but we're still doing all that work still. So if things need to get done with case investigation and contact tracing, it's still getting done. Some of the counties haven't had that many cases. So for instance, like looking at Kalkaska County, they're having like 1.5 cases on average a week. So there are some counties that just have really had a drop off in cases. But if you have concerns, get in touch either with me or with your county communicable disease nurse just to double check and make sure things aren't slipping through the cracks at all. All right, so another question about vaccine and travel. How long should people be entering information into VSafe? I have been doing VSafe, and I'm not sure if you mean how long will it keep asking you questions. I would say you should keep entering information until it stops texting you and telling you to enter information. So for me, it was asking it daily, and then every few days, then once a week. And then I got my second shot and it started asking me information more regularly again. So, so what I would say is just keep entering information whenever it sends you a message to enter information. Did you have a different question besides that?
No, Dr. Morse, this is Shelley Van Boers from Caslin over in Manistee. I've just had a couple staff members participating, and they're wondering, will it automatically prompt them to enter new information when they've had their second dose, or will they have to tell the VSafe system they've had their second dose?
Yeah, the one thing I was frustrated with is I got a prompt from it saying you should be due for your second dose. Have you had it yet? Well, I was scheduled the next day, so I said no. And then the next time it contacted me was a week later, and it asked me, you know, did you have your vaccine? Yes. And I put in the date, and then it asked, today, are you having these symptoms? Well, by that day, no, I wasn't. But after my second dose, I definitely had some symptoms. And so I wasn't allowed to put in what I did have, only what I was currently having. So that was one complaint I had of the system. But yes, it definitely did ask me, you know, reminded me it was time for my shot, and it did ask me, and it since has asked me again how I'm doing. So it will contact them when it's time.
Okay, thank you.
Yeah. In the reactogenicity reported, it does not list the effects after Moderna's second dose. So there just hasn't been enough because it came out later and there's a longer time frame. So they just haven't had enough time to get all that information and put it together to report it at that meeting yesterday. My suspicion is that it's going to be pretty much the same. Based on what I'm hearing from people and based on my own personal experience with Moderna, that it will likely be exactly the same type of information, probably about the same incidence and the same increase. So, you know, if any of our staff or anything have any thoughts on that, knowing people that have had Pfizer and Moderna, feel free to chime in, but I suspect it'll be very similar. School clinics on Saturdays are extremely appreciated. Yes, yep. I've heard they hope to modify current vaccine because, so Moderna is actually actively working on a new vaccine using the South African strain. So just in case that's needed. The beautiful thing with these mRNA vaccines is that if the RNA mutates, you just take that mutated RNA and slap it in a new vaccine and you have a new vaccine. So the problem is you can see how challenging it has been to vaccinate our entire population. So if we had to do that again, it would be equally as complicated. So at this point, it does seem that the vaccine is likely effective. It may be less effective, but they're, again, actively researching and looking at that. So this may be where it's going to be like influenza, where there's going to be mutations and variants, and we might have to have a new shot each year. It is way too soon to make that prediction, but it's a very similar process, very similar types of viral changes. And again, luckily the vaccine is very easy to change. It's just a big undertaking to vaccinate everybody. So we'll get there. Does anyone else have any questions at all for me?
Dr. Morse, I have a question.
Yep.
And it really comes, how are you doing? You hanging in there? Seriously, we appreciate all you're doing. So worry about you as well. So thank you.
Yeah, no, I'm pooped. My health officers, nobody else knows this yet, but I'm taking a couple days off next month. So yeah, just to try to get a brain break. I know I have it pretty easy compared to my nurses and my health officers. I pretty much just sit at home on my computer all day answering questions. They are on their feet all day long doing vaccinations and things. So the nurses are really the ones that are getting their butts kicked right now. So, but I think I don't want to speak for them, but I think they're excited to actually be doing something proactive rather than dealing with, all the bad parts of it. Now they're doing something that's good and people are appreciative and happy. So,
amen.
But thanks for asking.
Hang in there, all of you. Thank you.
Catherine, did you have your hand up?
I do. Is there some type of guidance document that I could use? I have questions coming up from physical education teachers that may be doing some type of educational activities around sports. Specifically, one teacher was asking about, can they teach skills in the game of basketball? And being that the sports have been put on hold for a while, they're not sure what they can do in their phys ed class as it relates to education about sports and team sports.
So they can do anything, including practices that maintain 6 feet of distancing and don't involve contact.
Okay. Thank you.
Yeah, and I can, I believe there's some infographics on the state website. So I can see about sending those to you.
That would be so helpful. Thank you so much.
Yep. What county are you in?
I work for Gracia Isabella RESD.
Okay, great.
Thank you.
Uh-huh. Anybody else?
Dr. Morse, this is Penny Dora from Montgomery ISD, and I just wanted to let you know that we just went through a Saturday clinic for our county at Central Montcalm High School, and it was very, very well done and very well received. Our educators just send a lot of appreciation to you guys for doing a Saturday clinic, and we've heard some really nice positive comments of appreciation. So I know Saturdays are rough days to give up, but I just wanted to say thank you very much for allowing us that opportunity.
Good deal. Anyone from MIT is on the call? That's all for you. Anybody else? If not, we'll get all this out to you or post it on the website, whichever, well, both. And we'll talk next Thursday. All right. Have a great rest